Test time for these school children. Not your usual exam, but waiting for the results of this one can be just as stressful. A new gargle and spit test for the coronavirus. Nicer than a swab, but it still needs to be sent off to a lab, and there aren't enough labs and tests to process every pupil in every school. Plus, doctors warn it's not a free pass from social distancing. The result only provides a snapshot in time. What happens after class or in the schoolyard? Virologists say wearing masks would be more effective. But try getting kids to wear masks all day at school. I found it hard enough to focus on my studies at school, but to worry about a pandemic? Schools have been reopening with new measures to keep students and teachers safe, some offering free weekly corona tests. DW's Julia Sardelli reports.
Students are back in class at this secondary school in Berlin. But after months of learning from home and a few weeks of vacation, this year's return to the classroom was unlike any other. A new spike in coronavirus cases across Germany is causing alarm. The school leadership is hoping that a major testing program will prevent any outbreaks here.
Of course, we take the other hygiene measures seriously too. But we still had this feeling of insecurity, especially after the summer vacations when people were able to travel again, that we might not be doing enough to get at least some warning about possible health issues at the school.
The school is one of just 3 in Germany to provide regular coronavirus tests to all its students and staff, for free. Once a week, they use a self-testing kit at home and bring the swab back to the school to have it analyzed. Parents feel safer knowing their children are being tested. Of course, when so many people get together, especially in a classroom, the likelihood of anything happening is relatively high. And it's a great comfort to know that tests are being done regularly. Around 1,300 students and staff attend the school. The test program is voluntary, but a majority is taking part, more than 1,000 people so far. Most students think it's a good idea, despite the test being slightly uncomfortable.
The test is actually quite simple. You have a test kit, which is quite self-explanatory after the first time you use it. It's a bit uncomfortable because you have to reach the tonsils with a swab to really take a proper sample, but you don't get more than a slight gag reflex.
The tests are being provided free of charge by a German biotechnology company. There have been no positive test results in the first 3 weeks. The hope is that any infections can be detected swiftly, so the school can remain open.
School isn't just a place of learning, but also a social place. You meet friends, and that's why I'm glad that schools have reopened. The interaction that we have in the classroom is impossible at home. That's why I'm glad to be back here.
The school believes the test program can also serve as a model for other schools across the country, helping keep students safe in and outside of the classroom.
Evangelos Kotsopoulos is CEO at Sonic Healthcare Germany and is also board member of Germany's ALM, the Medical Lab Industry Association. What's the use of testing at one school when you just don't have the resources to test at all of them?
Well, Ben, thank you for having me. First of all, we're a little bit skeptical about testing in school. For one reason, because what you just mentioned is resources. Resources are limited at the moment and they should be used for those who need testing most. But secondly, also because pre-analytical quality matters in corona testing. So that's the quality of how a specimen, a sample is taken from someone's throat. And we are quite skeptical whether 10-year-old kids, and I've got one of those at home myself, actually have the discipline to take a deep throat or a nasal swab sample. The consequence of these samples not taken properly is that we will report false negative results. And that's the worst of all scenarios where we are missing someone who is positive because the sample has not been taken correctly. And with kids, the younger they are, the higher we believe that is quite a risk. Secondly, the question must be asked what the purpose is of widespread testing in schools, because we know this PCR test is only a snapshot in time. It gives us an information about the moment the sample is taken. Every school kid can get an infection on the bus home or at home in the family when doing sports, and you theoretically have to repeat this for all kids in the country every day of the week, and that's simply not possible. So we advocate for more targeted testing.
You work in the business. What's your take on this new gargle test, or what are the best tests?
The gold standard, as we say, so for many tests, not just corona tests, there are different methods. There are different ways how to go about it, different materials, testing from blood, urine, sputum, or throat swabs. The gold standard, so the best possible quality at this point, remains the throat swab and the PCR test. At the same time, things develop very fast at the moment, also on the scientific and development side for corona testing. And so we are monitoring very closely what gargle tests, for example, can do, and whether a loss in sensitivity could be acceptable. So if this loss is not big enough, this could very well be a way to replace the throat swab. Although, to be honest, we're not talking about a blood collection or sticking a needle into people's arms. We are talking about a swab, which is a comparatively good way of collecting a specimen. So we don't necessarily see the necessity to replace the swabs altogether.
When it comes to results, what about these false positives and negatives people are talking about?
Well, every test has a risk of reporting a false result. These risks in PCR testing are extremely low, but they are not zero. And we have to differentiate a little bit what could go wrong. So if a test is false positive, we are telling someone you have an active infection, and in reality the person doesn't. Perhaps in a school setting, the swab has been confused between two different people, these kind of scenarios. The consequences of that are not overly dramatic, if we're honest. We might send someone into quarantine and into some unpleasant days accidentally, but the person itself and the wider society will not really have a problem from that. The false negatives is what we must avoid whenever we can. So telling someone you are tested negative, you have no active infection, but in reality they are positive. And this can happen, especially with swabs, from pre-analytical problems. So when the throat is not is not touched correctly, when the specimen is not collected professionally. And that is a real risk, because you have people returning to their workplaces, to visit family, to go back to sports or travel, and in reality they have or they carry an active infection. So the false negatives are the ones which are risky, and we do everything we can to keep the quality as high as possible to avoid them.
Evangelos Kotopoulos, thank you very much. And the World Health Organization has updated its guidance for mask wearing as millions of children return to school around the world. It says 6 to 11-year-olds should wear masks.
If there's transmission that's happening in a community, it can enter into the school system. So what we really need to focus on is bringing transmission down in the school system. We have outlined guidance on how schools can reopen safely. Everyone agrees how important it is that schools are operating safely, and we've outlined how that can be done in terms of physical distancing and hand hygiene stations, respiratory etiquette, the potential use of masks by either the workers or the children themselves. And so there are a number of considerations of how the schools can be opened. But again, we really need to focus on reducing transmission in the community first.
Now to some of your questions on the coronavirus, here's our science correspondent, Derek Williams.
How long will it take to make the estimated 5 billion doses of a vaccine necessary to provide herd immunity to the world?
This is another question where you would need a crystal ball to say anything definite, but I can hazard a guess. Production is a bottleneck that any vaccine will have to pass through, and depending on the technology platform behind it, that bottleneck could be more or less tight. Now, I don't have time to talk about all the vaccine platforms out there, so I'll just concentrate on 3 of the most advanced in terms of trials and how long it takes to make them. Messenger RNA vaccines, which are basically chains of specific nucleic acid sequences, they can be made quite quickly, but mRNA molecules are also unstable and currently need freezing, which complicates distribution. Developers in 2 late-stage trials with mRNA vaccines claim they'll be able to produce hundreds of millions of doses by the end of the year if approved, and that they can upscale rapidly after that to well over 1 billion doses annually. A second platform uses engineered adenoviruses to get the body to respond to coronavirus proteins. It's committed to producing around 700 million doses with different partners this year if it's approved. Finally, some inactivated virus candidates are also quite far along. They employ technology already used to produce vaccines like the one we have for polio, for example. But it also takes time to ramp up production because the virus has to be cultivated before being killed for injection. So even assuming that all those vaccine candidates and perhaps others are approved, I haven't read anyone who expects them to bring anything close to herd immunity on a planetary scale much before 2022, and that's really ambitious.
Finally, the coronavirus has robbed the zoo in Ho Chi Minh City of visitors and revenue, leaving zookeepers to think outside of the box, or cage. They're growing their own fruit and vegetables to feed the animals. Some of the small number of visitors now allowed in are bringing food too, but meat for the big predators is expensive. Keepers are giving up part of their wages. It costs around $8,000 a day to feed the 1,400 beasts. Animals would be a nicer word. They're lovely ones too. I'm Ben Fazulin. See you again very soon here on DW. Bye-bye.